The real challenge in acute medicine to actually turn these people around is to get there quickly and know what's going on and start to reverse the process. And there is no doubt that ultrasound has almost revolutionized that as an adjunct.
So point of care is a phenomenal tool to decrease the uncertainty, to decrease the differential, in general to give our patients a safety net. Wireless probes and all kind of handheld devices are actually changing the way we practice medicine. And especially these kind of devices that have the same-ish capabilities than the old card-based machines is not only a yes-no thing or a gross pathophysiology thing, where you can go into details.
It is almost certainly going to become absolutely mainstream, where it is almost the de facto way of examining patients, or adding to what we currently do.
I think the future it's the polyvalent medicine like general practitioner, that internist, that pediatric physician, and after I think it's the paramedics, the nurse, that's the future.
I'm both an emergency physician and a professor in medical school. So going back to the basics would be an important opportunity to teach our students, to teach our residents.
In the emergency department, we organize many sessions for ultrasound learning that permits us to teach more.
It's about 3 or 4 years to develop an expert. And we need 7. We have 10, about 12 today. That's why we need 5 years as the objective. If you have an objective of 90% of physicians who have the capacity to make the exam, you need to make a lot of teach all the time. And after you have to continue the teach to maintain the competence.
What we have as partner with Mindray, for example, we have 3 university graduates, 1 for the general practitioner, 1 for the emergency physician, and 1 on trauma.
There is so many people that need to be trained, to be formed in ultrasound, that the basic lines are very important. To use the probe, to have the good image, to manage the ultrasound while taking care of the patient. When you have already kept that skill, maybe we need to go more further and further, and we'll need to implement the AI and the virtual reality.
For sure, artificial intelligence has a main role in the development of education, patient care, artificial intelligence tools that facilitate basic novice users, optimizing the images, getting diagnosis like quicker, faster and safer. And as well, education makes a big difference. I can spend more time with my patients.
It's really an important question to accelerate the passage in the emergency department and to keep the quality. And I think communication of all this technology, it's one of the key.
The ultrasound facilitates the communication between us. So with the radiologist, with the cardiac, with the ICU physician, they speak well and they transmit the good information and the just information.
We can use ultrasound as a therapy. We can share directly the view of the body, the inside body of the patient, and when he sees it, it feels like a therapy. And I have in my experience one patient who told me that I was a different doctor. He came twice in the emergency, but no one has made his diagnosis. And I made it so easily, so simply, so quickly that he told me immediately I was like a professor. I feel I was at that time a better doctor.